My name's Sirey Zhang. I'm a second-year pediatric resident currently at the University of Utah. So we were analyzing trends in MRSA treatment over the last 8 years, up until 2024, compared to adults. The data regarding antimicrobial treatment when it comes to MRSA is pretty limited in kids. So we wanted to see the trends in antibiotic use over the last 8 years. We were able to do that using data from over 40 children's hospitals. We noticed that vancomycin is still the primary therapy in over 50% of all cases, but we also noticed that over the last few years, while rates of clindamycin have decreased, we are using a lot more ceftaroline, and that on its own or in combination with vancomycin or daptomycin as salvage therapy for possibly refractory cases. You know, we think of MRSA as a pretty serious infection, and we saw that actually over the 8-year study period, MRSA hospitalization rates have declined, which is reassuring. The gross number of MRSA infections requiring an ICU stay for a child has not changed, however. So overall, the proportion of kids with MRSA in the hospital are in the ICU compared to the regular hospital floor. I think we noticed a lot of variability between various children's hospitals in terms of what antimicrobials they're using. It'd be great to sort of compare outcomes and differences relating to what sorts of treatment regimens are done for MRSA infection. And with this variability, we can definitely look at ways to improve clinical guidelines, care models, and streamline that. There are new options that are out there for treating MRSA in children. The gut reaction to go to vancomycin is always very valid and useful in most cases, but when we have growing resistance, adverse drug reactions, or persistent bacteremia or infection despite vancomycin, it's nice to know that there are a lot of alternatives out there that are coming into view.